My name is Andreas. I'll be going over a part of health system design. There will be 3 topics for discussion today. We'll focus on operational objectives, concept of operations, and noting deficiencies. Let's first start with operational objectives. So, when thinking of objectives, we should come to this question. What is the goal of the program? Secondly, how do we accomplish these goals? Let's take our first goal. Let's say our first goal is focusing on diabetes. Now let's look at the objectives needed to fulfill the goal. We can say that to prevent diabetes, we need to provide health education. Now lastly, we want to think about how the solution is going to be conceptualized. Really think about it. What will the intervention or solution look like? Now, let's take a quick break to tell a story. Imagine that you're on a soccer team, playing against Barcelona. The sun is shining, and you're staring at the problem. That goalie, right there. That goalie is stopping you from winning the World Soccer Cup. In here, we have the goal of not just winning, but obliterating the competition. In fact, you want to win so much, you want to make that goalie retire out of embarrassment. Now, obviously to win, you need to have more points than the opposing team. Now, what do these points look like? They look like goals. You gotta hit the soccer into the net. Now, if we wanted to change how these objectives look like, we could say something along the lines of poisoning the players or stopping the other players from getting to the game. If they cannot play the game of soccer, then they cannot win. Therefore, they would lose by default in a shutout victory. The moral of this story, you can win many ways. However you decide, you need to decide how you will win and what that win will look like. Alright, let's go over the concept of operations. In addition to the previous questions, we should ask, how should we accomplish these objectives? We can have a method 1, a method 2, and yes, even a method 3. A really good question to ask yourself, what is the context that you operate in? Are you working with people who love ovals, rectangles, triangles? Really ask yourself, what is the operational context? Now, since we were focusing on diabetes earlier, let's go over how our community that we're working in can look different than others. Now, Hispanic culture is not abnormal for City X. Recently for Halloween, a lot of Hispanics dressed in Dia de los Muertos attire. In other cultures, this would be considered abnormal. Maybe because they don't have a lot of Hispanic influence. However, it is important to note the cultural differences that you work with. And let this young lady celebrating the dead be a reminder that there is always cultural context in the research environment. Lastly, let's focus on noting the deficiencies. Just because you decide how to complete a goal by understanding viable objectives that are liked in a certain concept does not mean you have figured out the requirements. I think this question accurately describes the dilemma of an inventory assessment and a needs assessment. What is needed to provide the follow-through? Now let's apply it. Let's take that same question and apply it to a diabetes prevention program. The mission statement is to stop diabetes. A goal is to prevent diabetes, and yes, there can be many goals, but let's focus on this one. On the left, we would want to reduce diabetes by providing health education. On the right, an alternative solution would be to reduce diabetes by increasing access to farmer markets. The design on the left requires the concept on a website to house education and coaching sessions. On the right, the concept relies on a digital stipend to improve transportation between points of access. Now, let's change the objective just to show how flexible these can be. Now we are focusing again on an access issue, however, the concept is now an e-commerce website to provide same-day shipping and subscription to local farmers. Let's look at what's needed. An online web page, advertisement of the web page, an individual to process the digital data, methods to improve patient engagement, i.e. the call to actions. On the alternative solution, a web page for e-commerce, secure transaction security, collaboration with a transportation company, COVID-19 precautions, collaboration with local farmers, and automation of sales. So here we have gone over operational objectives, how do we complete the goals, the concept of operations, how will our audience like our formats, and lastly, noting deficiencies. What is missing and what is their financial equivalence in obtaining them. Thank you for your time. I hope you enjoyed this presentation. Please be sure to like and subscribe so you can get the next video. Till then.